We are Group 21 and we are doing our project on type 1 diabetes.
Type 1 diabetes, formerly known as juvenile onset diabetes, is an autoimmune disease where the pancreas produces little or no insulin. Insulin, a hormone, is what allows sugars to enter cells as energy from the bloodstream. Type 1 diabetes is caused by the cells in the pancreas that produce insulin attacking and killing themselves. Currently, there is no cure, but type 1 diabetics can use external sources of insulin and adjust their lifestyles to ease the effects.
Different studies looking at prevalence rates among different groups have found that the rate is generally higher in the non-Hispanic white population across all ages and lower in Navajo from ages 0 to 19. Other risk factors can include age, as children are more likely to be diagnosed, a family history or variation in genes, a history of autoimmune diseases, seasonality since onset seems to be higher in late autumn to early spring, insufficient exposure to early infections, and diet such as time of incorporation for cow milk and wheat products. On the other hand, increased vitamin D consumption in both the mother and child seem to decrease the risk.
To test for diabetes, doctors will order an A1C test, a fasting blood sugar test, a glucose tolerance test, or a random blood sugar test, which are all different methods to measure and detect high blood sugar levels. Testing for autoantibodies and/or ketones are a great way to decipher type 1 diabetes from type 2 diabetes. Although there is not a cure for type 1 diabetes, there are treatments aimed to maintain normal blood sugar levels, such as insulin injections or insulin pumps. Doctors also recommend healthy diet and exercise, which can help control blood sugar levels, but also prevent illnesses such.
Because type 1 diabetes cannot be cured, the methods of treatment and prevention do a great deal in alleviating the condition. It is important to note that the problem that arises is accessibility to treatment, as insulin injections are costly, especially if a patient requires a consistent dependency on the treatment.
There are many common misconceptions about individuals with type 1 diabetes, the first one being that diabetes is caused by eating too much sugar and an unhealthy lifestyle. This is not true. Why diabetes occurs is still unknown, and all we really know is that there are genetic and environmental factors that seem to be contributing factors to the disease. Another common misconception is that kids grow out of type 1 diabetes. This is also not true. Type 1 diabetes is a lifelong disease and there's currently no cure for it, only medication to help treat it. When looking for broad information about type 1 diabetes, the CDC website offers a ton of resources for anyone interested. And when seeking for personal care, it's best if one contacts their personal doctor. That way, medication can be prescribed, new lifestyle regimens can be planned, and our doctors can refer individuals to support programs if needed.